Hi, I'm Dr. Aradia and welcome to My Doctor Told Me. Today, I'm hoping to talk about diabetes, which is a common but still quite a complex disease that's often misunderstood. There's quite a lot of misconceptions around diabetes. So I'm hoping to touch on some of these and I hope that you find this useful. The first and by far the most common misconception about diabetes is that eating too much sugary foods can lead to diabetes. This is not quite true. Yes, there is a relationship between diabetes and sugar levels in your blood, but really diabetes is a disease of insulin. Insulin is the hormone that allows sugar in your blood to then be passed into the different cells in your body, which needs the sugar for fuel. What happens in diabetes is that you either don't have enough insulin or the insulin that you have, your body is resistant to it. And so this means that the sugar that's in your bloodstream isn't able to pass into the cells that need them. And so there's a rise in the level of sugar in your blood, and that leads to the symptoms and the complications of diabetes. So, in summary, sugary foods don't lead to diabetes, but diabetes can lead to you having high levels of sugar in your blood. The next common misconception about diabetes is that it's a disease for the obese or for the overweight. And well, this has some truth to it in that type 2 diabetes, which is one of the most common types of diabetes, has this link with obesity. It is a risk factor. But it's important to note that there are lots of other risk factors for type 2 diabetes. Particularly, familiar traits, there are genetic predispositions to having diabetes. There's particular ethnic and minority groups that are more predisposed to diabetes, like Asians and Black people. And also, there's a number of health conditions that can predispose your risk of having diabetes, such as gestational diabetes during pregnancy, PCOS, or even metabolic syndrome. So, really, there's a number of different risks that predispose you to diabetes, and it's not just being overweight. The final misconception about diabetes that I thought was worth mentioning is the misconception that diabetes is not a serious condition. I think this misconception exists because, diabetes is such a common disease and lots of people have it. However, it's important to mention that diabetes has really widespread impacts if not properly controlled. It can affect the eyes, the kidneys, the liver. It can lead to cardiovascular complications, risk of strokes and heart attacks. It can really wreak havoc all over the body if it's not carefully controlled. And that's the important aspect. Diabetes is quite well understood, and there are lots of treatments that work really well for diabetes. So if it is well controlled, then the risks, all of those risks and complications can be greatly reduced. But certainly it can be a serious condition and it has to be taken seriously. Thank you very much for watching. I hope you found this useful. If you have, please feel free to like, subscribe, or forward this video on to someone else who you think may find this information useful. Thank you.